GPs were very early adopters of technology in practice. From the early 90s, GPs have been using software tools, and they've been innovators in how we use data. What we're also calling on now is integration of how that data is used with other health systems. So the hospital sector, our non-GP specialists. One of the things that we've noticed is that the level of digital health literacy is low. So there is an opportunity not only to educate our patients, but it's about access and how do we get those who are most vulnerable, who have troubles accessing, maybe it might be through English as a second language, with our aged care sector, with those who actually are in poverty. How can we enable and access for those populations? The connectivity means, how do our systems talk to each other? So how do we inform the hospital sector of what's happening and changes with our patients, and vice versa? So that then becomes a discussion about safety. Now, those discussions are ongoing, but the problem in the past is it's always been siloed off. So, said general practice, we've been innovators. What we now call is everybody else to come with us and connect and do this on behalf of our patients, because this is what they expect. They actually expect that all of our systems are talking, and they don't.
We understand how busy doctors and nurses are during their consults today. They have a never-ending amount of things that are on their plate they're expected to do, and we see technology as a very powerful way to help support doctors and nurses by taking things off their plate, by helping streamline their communications with patients and optimize that doctor-patient or nurse-patient consultation. So we've built a number of different tools over the last 10 years that help to support both doctors and nurses.
Technology and innovation is really supporting general practice to provide continuity of care. And when we talk about that, that means from the person comes into the consultation. So, for example, it might allow the person to actually say, this is what I'm coming for, this is what I expect. So this is then about empowering the patient on how they deliver information to the GP. From a GP's perspective, it is about knowing what comes through your door. So it helps you prepare, and that mindset, it makes from more efficient consultation. And it actually will help you get that agenda out. Technology then continues through not just the consultation, but after the consultation, with how we have communications around results and follow-up. And there are now systems that enable us to send text messages or follow-up appointments and those sorts of things. So it increases that dialogue between patient, GP, and their practice. It allows for continuity, connectivity, and ultimately safety.
We have now a team of general practitioners, allied health service providers and specialists. I heard about BetterConsult through my practice manager. She'd mentioned that BetterConsult would improve the efficiency of the practice, and I thought I would give it a go.
Some of the challenges I face as a practice manager are time management, making sure that our patients are seen on time, and making sure that our doctors and staff have a good work-life balance.
We've got a product called BetterConsult, which is a pre-consultation clinical questionnaire that patients fill out before they see the doctor or the nurse. And the idea being that the tool actually asks the patient why they're coming to see the doctor or the nurse. It takes them through a structured multiple choice-based questionnaire, and then we take those answers and translate it into a concise bullet point summary. So before the patient even walks in, the doctor or the nurse has a concise summary of why the patient's coming to see them, can ensure they spend time in the most clinically important areas, and reduce their documentation burden.
I always read through the BetterConsult notes because it always gives me an indication of what they're coming in for, which definitely helps me plan my consult and the questions that I need to ask.
There are also challenges with some of that technology. Challenges are often patients have got, a relationship with their GP. They know them well. So then it's also about expanding that trust within the team, and also reassurance about how the general practice is using their technology. So people are now getting very mindful about their personal information, and they do want to know how it's being utilised. So the opportunity then is for general practice to explain to the patients how it's worked and all the systems that we have in place, because we, as a practice owners, spend a lot of money on and time ensuring that we safeguard patient privacy.
Cybersecurity, especially in the health space, is extremely important, health data being one of the most valuable pieces of information that hackers are trying to get to. And where we see our role is in building tools that are secure and encrypted and ensure that patient information isn't able to be accessed by any third parties. But change management is a hugely important area and something to consider when any sort of new technology is being rolled out in practices. And typically practices work with their IT support groups, and we work with lots of those support groups throughout Australia. And those IT support companies' role is to really ensure that any technology that's added onto the server of the practice is secure, has gone through appropriate checks.
As a GP, managing cybersecurity is a significant challenge. It's also a user of time and resources, and it is one of those essential things that are required for operating a practice. And as I said earlier, general practice has been a leader in using digital technology and software and how they operate, which also means that we need to have those systems in place and ensure that they're very well resourced. Continuous learning, continuous updating, being on top of it. There's a lot of support from RACGP to its members for managing the implementation of cybersecurity and their software and their hardware. But it's not just the GP, it's actually all of our staff. It's our administrative staff, it's our nursing staff. So what we're trying to do is build frameworks around our teams and ensuring that we continuously keep up to date to ensure safety for our patient staff and our businesses. It is complex and it is resource intensive.